Hello, I'm Jodie Bizet O'Brien, part of the AWI Extension South Australia team. In today's 10-minute talk, we're going to hear from Dr Steph Warwick on foot abscess.
My name is Steph Warwick. I'm a livestock vet and part of Elders' livestock production team. I work with farmers from Kangaroo Island, across the hills and Fleurieu, out to the upper southeast and through the Mallee. It's been really wonderful this year to see a green autumn after a couple of really tough years. We've got really great reports of lamb marking percentages, and seeing merinos raising twin and triplet lambs has been wonderful to see. It has brought with it, however, its own unique set of animal health challenges. So we're seeing more toxic weed issues, we're seeing some trace mineral issues, and particularly now as we head into winter, we're starting to get quite a few reports of foot abscess coming through. So foot abscess is a really debilitating, painful condition that occurs commonly in sheep flocks. It causes a great deal of pain and swelling in the affected limb, and can have quite significant production and economic consequences for the producer. It's caused by bacteria that are found commonly in our environment. However, they are bacteria that thrive in warm, wet conditions like those we've experienced lately. One of the common bacteria that's implicated is called Fusobacterium necrophorum. This bacteria is actually found in the gut of normal, healthy sheep, and then can persist in the environment in manure and mud and those sorts of places. So to gain entry to the foot of the sheep, this bacteria needs there first to be a weak point or some underlying damage. The bacteria then enters through that weak spot, where it then takes control, the infection forms, and the result is very painful abscess. So risk factors for foot abscess can be anything that is damaging that sensitive skin or hoof tissue. So these are things like, the big one at the moment is just soft, damp skin. So these sheep have been standing in either lush feed or wet ground for months, and the skin is becoming very vulnerable, very soft, and allowing easy entry for the bacteria that way. However, other risk factors would include things like rocky ground, canola stubbles, even hearing reports of cowtrop thorns causing issues. And so the other big risk factor is other underlying hoof disease. So things like interdigital dermatitis, where we get that sweating between the toes, foot rot, scabby mouth causing foot lesions, or even laminitis, where we get those hot feet after grazing either nitrate-rich or starch-rich feeds. All will cause the necessary damage that can then precede abscess formation. So as a rule, if we see more than 10% of a flock lame, I would recommend that you contact your local vet just for further investigation to make sure that there isn't an underlying cause of lameness that is causing these secondary foot abscesses. Foot abscesses on their own we would expect to cause less than 10% lameness, and to be fairly intermittent and sporadic in nature. So another risk factor for foot abscess is simply the weight of the sheep. So it's just simply a case of more weight placed onto what are fairly small hooves. So heavy sheep are particularly susceptible. And by that I mean rams, late pregnant ewes, particularly those pregnant with twins and triplets, which we have had a lot of this year, as well as just sheep that are really fat and over-conditioned, which again, we've got quite a few of those around the place this year. So the first sign of foot abscess is generally lameness. So noticing a ewe or a ram who is extremely sore in one foot. The pain associated with foot abscess is really quite significant. So the lameness is very severe. They're generally not wanting to weight bear, so really hobbling and struggling to get around. On closer inspection, all the signs of an abscess are there, all the signs of infection are there. So we're talking really marked swelling around the lower limb and the hoof, redness, heat on touch, quite a marked swelling is the thing that number one thing that you'll notice. Often as the infection progresses, it can burst, so then we can see discharge coming normally either from between the toes or from the coronary band, which is the area where the hoof meets the skin at the top of the hoof there. And really that's your classical abscess. A foot abscess generally will only occur in one foot. That's not a hard and fast rule, but certainly more commonly they will only occur in one foot and will only occur in adult animals or heavier set animals. So that's in comparison to something like foot rot, which might be another differential diagnosis. Foot rot will affect multiple feet and sheep of any age. So with foot rot, it's quite common to see quite young lambs really badly affected. If you suspect that you do have foot abscess on your farm, then it is worthwhile making sure you do get a correct diagnosis, just to ensure that the treatment and prevention is appropriate and is actually going to yield the results that you're looking for. So this is going to involve catching and tipping sheep and having a really thorough inspection of their foot. If you are seeing more than 10% lameness, make sure you're having a really close look for those other hoof conditions and perhaps call in your local vet or advisor for a second opinion. Yeah, it's really important that we get the diagnosis right so that our treatment and prevention strategies are going to be effective. So foot abscess can be a really economically damaging and costly thing to have on the farm, along with the animal welfare issues associated. One of the worst case scenarios that we do see is when we have an outbreak of foot abscess in late pregnant ewes, particularly those carrying twins. And this is a really difficult situation to have. The trouble that we have is the pain associated with a foot abscess is actually significant enough to stop them from grazing, to reduce the number of hours a day they spend eating. This leads to an energy deficit which results in pregnancy toxemia. So many producers will be familiar with pregnancy toxemia and how difficult and challenging it is to treat and how high the mortality rates can be for ewes and their unborn lambs. So treatment of foot abscess in these late pregnant ewes is really difficult. Often we're receiving calls or these ewes are developing these abscesses as they're starting to lamb or as the flock is starting to lamb. So yarding them often isn't a option. So management and treatment of foot abscess in these late pregnant ewes can be really, really tricky. So as you can see, the costs of foot abscess can be really quite substantial. So with the pain comes the reduced grazing time, comes reduced weight gains, pregnancy toxemia in pregnant ewes and potentially subsequent mortalities. We see reduced fertility in both rams and ewes following severe abscesses. And then also we do have a percentage of ewes that will have long-term hoof abnormalities as a result of the infection. So that's then causing sort of chronic lameness and ongoing management issues. So treatment of individual sheep focuses on getting that abscess to drain, so debriding the abscess until drainage is established, then following up with antibiotic and anti-inflammatory treatment, which you can get from under prescription from your local vet. It's also important to move the sheep to a dry environment and make sure all your basic animal husbandry needs are taken care of, so shelter, food, good quality food, water, to allow them to heal. And then the other thing worth considering if flies are around is certainly a fly treatment, because these infected feet do have a habit of becoming fly strapped. Prevention is always better than a cure, and there are a range of prevention strategies around. It's just a matter of working out what's going to work best on your property and what you think the key risk factors are. So an important one that's often quite simple is to allocate your drier paddocks to your higher value multiple bearing pregnant ewes to avoid an abscess outbreak in them. Ensuring that any underlying foot issues are controlled. If we are seeing any of that interdigital dermatitis, that sweating between the toes, then things like a foot bath with 10% zinc sulfate is quite effective in drying that out and hardening the hooves. That obviously needs to be done in preparation for the risk period. Managing nutrition is really important, and so there's a few different aspects to this. One, in avoiding ewes becoming too heavy and overconditioned, so avoiding overfeeding. Another is minimising any of that laminitis risk. So when I'm talking about laminitis, I'm talking about that inflammation in the feet that causes that sort of hot feet that we see on really rich feeds. So that can be done by balancing the diet with perhaps a good quality cereal hay, or even a high fibre cereal grain. So oats in the feeder is the classic example. It's also really important to ensure that the nutrition is adequate and that we are not underfeeding. We need the immune system to be functioning at its best, which requires good nutrition. So not only are we getting the adequate energy and protein into the animal, but then we can also look at correcting any trace mineral deficiencies as well. So we know there is a bit of research out there showing the importance of zinc in hoof health. So testing and looking for zinc deficiencies and potentially supplementing for zinc can be really effective as well. Obviously a longer term strategy rather than a short term fix. Hoof trimming is also important, so getting rid of any of those abnormalities, those long curved toes that then can result in cracks and allow bacterial entry into the hoof helps. However, on the other hand, it's important not to be overzealous with the hoof trimming and not to create thin soles and cut too short. So as you can see, we have a perfect storm of risk factors for the development of foot abscess across the state. While it remains wet, the risk will remain. To find out more, AWI have some terrific online resources. Your local vets can help, as can your local industry reps and agents. It really is worthwhile chatting to people in the know to ensure that we've got the diagnosis right, we can get an effective treatment, and more importantly, some really great preventative strategies so that your sheep flock doesn't suffer from foot abscess.
Steph, thank you so much for sharing your experience and professional knowledge on foot abscess. This 10-minute talk was supported by Australian Wool Innovation, the South Australian Sheep Industry Fund, and the Department of Primary Industries and Regions. If you'd like to know more about AWI Extension South Australia, you can go to our website and follow us on social.